all.
Good evening, ma'am.
Good evening, ma'am.
Okay.
Good evening, ma'am.
Happy evening to all. My name is Ashwathy Rajan. I am one of the OET aspirants and admin panel members of the OET Edu Skills platform. First, I would thank God Almighty for this wonderful platform, and also I convey my thanks to our mentor, Father Saleen Joseph. All of you know, today we have our writing subtest, which is a continuation of the previous session. So once again, welcome back to Edu Skills International. My name is Ashwathy Rajan, and I am dealing with the body paragraphs of OET Writing. Are you ready?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
In the previous session, Rajani Chichi took class regarding the OET Writing, relevant case notes and introduction para. I am going to take the class regarding the body paragraphs. According to our mentor, Father Saleen Joseph, the body paragraphs are the fifth step of our OET writing. So, in OET writing, body paragraphs, which includes first para, which includes the continuation of the purpose para. That means complete explanation of the purpose para. And the second, the following para, which includes what happened during the hospitalization period for the patient. I think all of you have a hard copy of our case note. So please take that hard copy with you. Next para, which includes the request paragraph, and the last one is the sign off. But in our platform, there are many steps before that, before ending the sign off page. First, we need to go through the case note. In our case note, our patient name is Mr. Gerald Baker. Our patient name is Mr. Gerald Baker, and he is 79-year-old. He is admitted to the hospital for an elective surgery. That means left total hip replacement. So, in our body paragraphs, for the first para, we need to tell regarding the admission. That means Mr. Baker was admitted on date 03/09/2018 and underwent the surgery. So, first paragraph, which includes Mr. Baker was admitted, admission date, and underwent the surgery. Postoperatively, he suffered from some disorientation. That means in our hard copy, we have the assessment page. In that assessment page, all details are given. Good mobility, post-operation, when weight bearing, post-operative disorientation, retime, and place during recovery, possibly resisting to anesthetic. All these word notes are there, and we need to change each sentences into compound and complex sentences. So in body paragraph 1, we need to take we need to add compound and complex sentences. So, but in OET writing, flexibility is more important. So it's just an example for the first paragraph. You can write your first paragraph as your own. So flexibility is the main key part in OET writing. Then according to this, postoperatively, he suffered from some disorientation, possibly caused by the anesthetic, which will require your ongoing observation. What is our introduction para and what is your purpose?
Continuing care.
Continuing care.
And monitoring.
Ongoing care and monitoring.
Ongoing care and monitoring.
Ongoing care and monitoring, ma'am.
Okay, ongoing care and monitoring. That means we need to continue the next para with the purpose. All details related to the purpose should be in the next coming para. That is all what happened during the hospital. According to ISBAR method, already our mentor posted ISBAR method in YouTube. You can watch that video, and after regarding ISBAR. So after that, then when you check the details, you can understand that. Purpose para, following the next para is the first paragraph. That includes why the patient is admitted in the hospital and what during that time, what problems he had. And
Yes,
also
ma'am.
we
Who write,
we need,
whom write?
pardon?
Ma'am, who write and whom to write? किसको लिख रहे हैं?
That all sentences we get in the introduction and the line, or before the body paragraphs, all details are coming. Is that right? Flexibility means you can write your letter in a way that you love, but we need to follow all the protocols. In this, please note, in addition, then after in addition, we have put a comma. This is our rule for OET writing. In our hard copy, they already said his HB is dropped 72 gram per DL postoperatively. So, who is the reader?
Senior nurse. Senior nurse, ma'am.
Senior nurse.
Okay. What is her name?
Samantha.
Samantha
Bruin.
Samantha
Yes.
Bruin.
Yes. Miss Samantha Bruin. So, we are writing the letter to Samantha Bruin, who is a senior nurse at Greywards Nursing Home. Greywards Nursing Home is Baker's nursing home. He
Yes,
already
ma'am.
stays there.
Already
So,
lived there.
already lived there. So she knows all details regarding Baker. We
Yes,
have to tell during the hospitalization and what happened to him, and
After
also
surgery.
after surgery, what happened and what all need to be continued during the post-operative period.
Yes, ma'am.
So,
Ma'am, we have to write only during hospitalization and current situation, because the
Yes,
social background and medical background, she always known about this.
she's already known regarding that. So the social background, medical background, all she knows. So
Yes.
it is not important to. It is not at all important. Not at all need to write the social background and medical background. When we write this medical background and social background, our score will also our word count also will increase more than 200. Hemoglobin dropped to 72. 72 mg per dl is important. Dropped to 72 gram per dl. And the last sentence, therefore, ongoing monitoring required for anemia. Have any concern regarding this writing body paragraphs? You can just watch the video on YouTube, because our father, Saleen Joseph, posted all videos regarding 21 points, 21 steps for our OET writing. I know OET writing is a little bit difficult, but once you take each step for each day, then we can write a wonderful story about our case note. Then we can go to the next para. In this case note, the case note is very small. So the second paragraph, nursing management and progress is there. There they tell daily dressing, surgery incision site, range of motion, stretching and strengthening exercise, occupational therapy, staples to be removed in 2 weeks, 21 September. Also follow up FBE and UEC tests at City Hospital Clinic. That means in this, what progress happened to the patient. That is what progress happens to Gerald Baker. In this, all relevant notes are, which all are relevant in this? Could you please tell me?
Surgical dressing.
Exercise.
Range of motion exercise.
Stretching and strengthening exercise.
All the details are important, because during the hospitalization, the patient post-operative period. This is the
Yes,
post-operative period, and the progress happened to the patient is mentioning there. That's why I think all these points are important.
Yes.
During hospitalization, comma. After Mr. No need to put a full stop, was initiated with daily dressings of surgical incision site along with occupational therapy and range of motion exercise. First sentence itself become a complex sentence. That means during hospitalization, comma. Then he was initiated with daily dressings of surgical incision site, then along with occupational therapy and range of motion exercise. That means separate points are there. Daily dressings, exercise, and occupational therapy. All these three items we mix it together and make a complex sentence. And after range of motion exercise, comma, which needs to be continued. That means in the discharge plan, they told continue exercise program. Okay. Then the next sentence, presently, Mr. Baker can bear his own weight and with the help of a wheelie walker, can walk short distances. This all the reader, who is our reader, Samantha Bruin, don't know. Presently, Mr. Baker can bear his own weight. So we need to tell her regarding his present situation. That's why I add this point here. Then this sentence, next sentence is the continuation of the previous one. That means he can walk. Now he can walk with the help of a wheelie walker up to short distances. For walking which he needs, that's also a continuous sequence-wise exam. Sequence-wise, we have lent Mr. Baker a wheelie walker. For supporting devices, all are supporting devices. So we need to put all supporting devices for Mr. Baker after this major first sentence, important sentence, topic sentence. Presently, Mr. Baker can bear his own weight and with the help of a wheelie walker can walk. For walk, he provided with the supportive devices such as wheelie walker as well as wedge pillow and toilet razor. And the latter of which will need to be returned in 2 weeks. That means the toilet razor will need to be returned in 2 weeks. Next sentence, presently Mr. Baker can bear. Then presently Mr. Baker can. Next continuation, sequencing word. Sequencing word is according to our father's reading strategy. We have to follow all these sentences. When we try to learn each step during each day, then we can simply learn to write our OET writing very easily. Then in our hard copy, is it necessary medical background? You already told me medical background is not important. What is his current medications? Could you please tell me?
Aspirin 100 mg morning.
Aspirin 100 mg and post-operative Benadryl.
Yes, actually
Canadian
the
Forts.
senior nurse already knows, takes aspirin. But before procedure, it's a elective procedure, so that aspirin is stopped before procedure. So it is important to tell regarding aspirin. Post-operatively, the aspirin, the doctor restarts the aspirin. So it is important to tell to the nurse. That means our reader. Then also the pain management, Panadine Forte maximum 8 per day. So his current medications includes aspirin 100 milligram post-operatively, as well as Panadine Forte maximum 8 per day for pain management. Next is the request paragraph. In request paragraph, you can write, in request paragraph in our hard copy, they are given discharge plan as monitor medications, especially Panadine Forte, preserve skin integrity, continue exercise program, equipment required, wheelie walker. That all we mentioned in the second paragraph. So I didn't mention that exercise and equipments here. I just write, for example, this request para, I just write, upon discharge, comma, Mr. Baker requires daily dressing and the staples will need to be removed on the 2109 at the city hospital clinic, where he should also undergo full blood examination. Because the reader is a nurse, so it is not important to write the full explanation, full blood examination and UEC test. Both of them we can write the simple words, FBE and UEC tests. I know OET writing is little bit difficult, but when you follow our father's strategies, then we can write our letter in a simple way, simple and legible way. So if you are not watched father's video, please try to watch all videos. When we are practicing writing, you can watch the writing videos and take notes. Each day you can practice each step. Then one step, then try to write that step only that day and try to write more sentences regarding that step. Then try to write compound and complex sentences. First, write compound sentences. The previous sessions, our discussion sessions, we learned regarding the compound and complex sentences. So when we are confident regarding the compound and complex sentences, then we can simply use this all sentence structure in our letter. Then in this case note, then the last session, if you have any questions, please do not hesitate to contact me. Flexibility is important. You can write another way. I just write this one. If you have any questions, please do not hesitate to contact me. Then the sign off. Last step in this letter, yours sincerely, then charge nurse. Any doubts?
Ma'am, I have a question.
Yes.
Ma'am, in case notes, aspirin is 100 mg, then after that there is one word, MANE. What does that word mean here, ma'am?
Morning.
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 Yes. Main, M-A-N-E, main is morning.
Main, M-A-N-E, main is morning.
Ma'am, okay, thank you, ma'am. Ma'am, Panadin 40, there they have written 2 tablets QID. It means 8 tablets.
QID means 4 times.
Okay, ma'am. Ma'am, PRN
Okay.
also written, ma'am.
PRN if required. PRN means if required.
Okay, ma'am. I have another question. In assessment,
If you have any other doubts, you can watch the video in YouTube and you can ask your doubts in the comment space there. Father or any of the admin panel members will answer your questions.
Thank you, ma'am.
Thank you, Ashwathy, for the
Thank you,
today's
ma'am.
session. It was a wonderful session.
Thank you, ma'am.
Thank
Thank
you.
you.
Thank you, Ashwathy, for this wonderful session.
Thank you so much, ma'am. Thank you.
Thank you. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you.
Okay.
Bye bye. Thank you, Ashwathy, once again. Bye.
Thank you, Ashwathy. Bye bye.
Bye bye.